All right, so the first thing you're gonna do is perform hand hygiene. And here we have Ricky. Ricky's 9 years old, and he was diagnosed with diabetes about a year ago, and he's not feeling too well today. So and Ricky, my name is Mimi. I'm your nurse today, and we're gonna perform a head-to-toe assessment. And if at any time you need me to stop, pause, or if you have any questions, just ask, okay?
Okay.
So the first thing, can you tell me your name, Ricky, and your birthday?
My name is Ricky, and I was born on June 14th.
Okay, and where are you right now?
At the doctor's office.
Great. When were you diagnosed with diabetes?
1 year ago.
Okay, and can you tell me the name of the virus that has been a huge pandemic in the last year?
COVID-19.
Okay, great. So we just know from this, basically just talking with the patient, that he's alert, he's oriented to person, who he is, the place, and time. So we had our lovely nurse assistant. I know she took your weight outside of this room, and she took your height, and it looks like you're the same height as about a year ago, and you've actually lost a little bit of weight. We're just gonna get a set of vitals on him. So Ricky, I'm just gonna have you, I'm gonna get a temperature here.
That's gonna go right under your tongue. And I'm just gonna take your pulse, which is normal. We're gonna pretend blood pressure comes on, and we're gonna take his blood pressure and get an oxygenation level on him. So we'll have heart rate, blood pressure, oxygenation. We'll get this temperature on him, and then we'll also get a pee level.
You do have a little bit of a fever, 101.1, which probably explains why you're not feeling very well. So that's not very surprising. So we'll just continue on with our assessment here. Are you in any pain?
Yeah.
On a scale of 1 to 10, 10 being the worst pain you can imagine, 5 being you appear okay, but inside you're really, really hurting, and a 1 being just, I'm hurting. How do you fall on that scale?
Probably about a 5.
Okay, so
maybe a 6.
You're hurting a little. Okay, and that was your foot that you mentioned, or your mom mentioned that. Yep. Okay, so like I said, we're gonna go head to toe, but we'll really take a good look at your feet, especially because diabetics really need to be very vigilant about their foot care and looking at their feet and taking care of them. So we will do that at the end of our assessment here. So now before we really start with the head, we're just looking at Ricky's general appearance. He looks good. His face is aligned. Everything is symmetrical. He doesn't have any facial droop. So that's very reassuring. When we're looking at his ears, those look symmetrical as well. And his skin, he's actually a little warm to the touch, which we know he has a fever, so that's not surprising. But his skin is actually a little dry as well. When we look at his head too, and we look at his overall complexion, he is Caucasian, so we know that his skin color is appropriate for his ethnicity. No impetigo, from what I can see so far, no moles or marks or scars or anything like that. So like I said, we'll see the full thing later, but from what we can generally see, everything looks good. Now the first thing I'm gonna do, Ricky, is I'm just gonna inspect your hair. I know it seems kind of bizarre. You probably have had this done a few times in school with head lice and stuff like that. So that's just what I'm doing. I'm just looking at your skin and looking at your scalp, and we don't see any moles, no infestations. And Ricky also appears to have really good hygiene, so that's good. He doesn't smell bad. He doesn't have greasy, dirty hair. His hair is very clean. There's no alopecia there. There's no balding spots, and no signs of head lice. So you're doing good. Now the next thing I'm going to do is I'm going to palpate the pulses on your face and your neck. So the temporal pulses, I'm actually just going to take these glasses for just a second. I'm going to have you hold those for me, and I'm going to just put my hands right here, and we can feel his pulses. I'd probably grade them a 2+. And then we're going to feel his carotid pulses here, and those are definitely 2+, and actually on him I can see them kind of bounding out from his neck. So you have very good circulation and a very strong heart. Now the next thing I'm going to have you do, we're going to check cranial nerve 5. So you're going to bite down and clench your teeth. Perfect. And then I'm also going to have you, we're gonna do another cranial nerve. It's cranial nerve 7. So puff out your cheeks. I want you to squeeze your eyes tight, really shut. Smile and frown. You can open your eyes now. Smile, frown. And then the last thing I'm gonna do is just palpate your sinuses. And I want you to tell me if it feels uncomfortable at all when I'm pressing here.
Nope.
Okay, what about
Feels okay.
here?
No, it feels okay.
Okay, and just your maxillary. I know some people don't really feel that at all, but
Yep.
I just like to check it. Okay, fabulous. So now what we're gonna do is just really look at his eyes. We know that his scleras are white, so we don't have any jaundice problems with that. His eyes are aligned. Try to just look at that camera for me. Can you do that? His eyes aren't shaking. We don't have eye droop. So those are all really reassuring signs. His eyes are also not totally sunken in. He's not super dehydrated looking. No shaking of the eyes, which is also known as nystagmus, and no strabismus, strabismus. So he doesn't have an eye that's kind of floating away. They're both perfectly aligned. So now we're gonna test your eyes. So the first thing I'm gonna do is you're just gonna look at this stick, and I'm gonna start to move it up. So you're just gonna keep your head straight forward, okay? We're gonna go up, down, side to side, and then I'm gonna go diagonal. Great. And then this way. Perfect. Okay, now I'm gonna bring this away, and we're seeing his pupils are getting bigger and accommodating, and then I'm gonna bring this close. You're gonna start to get a little bit cross-eyed, and now his pupils are starting to become fixed, and he's bringing his eyes toward the nose. And now I'm just gonna check. Sorry, I gotta whip out my little flashlight here. And we're just gonna watch, you're just gonna stare straight ahead, okay? We're gonna bring this right in, good. And same thing on the other side. Great. So his pupils, they're equal, they're reactive to light, and they accommodate. They move through all of the fields perfectly. And I know you have glasses, but have you needed a new prescription lately, or have you had any vision changes?
No.
Any issues of glare at night?
Nope.
Okay, good. So in testing all of the eye movements and the pupils, that was also cranial nerves 3, 4, and 6. So we knocked out a few more of those. Now you might be wondering why we're checking all these cranial nerves. And there's 12 cranial nerves in the system, and we just want to check them because on diabetics, sometimes those cranial nerves start to change, and so we just want to make sure that all of those nerves are intact and that they continue to be intact, okay? So now we're gonna just check your nose. So I hope you didn't see what flavor this is, but we're gonna check cranial nerve 1. This is the olfactory cranial nerve, and I want you to tell me what smell this is.
Orange.
Great, yep, this is orange oil. He's correct. So that nerve is intact. Have you experienced any redness, drainage, a lot of boogers, congestion?
Nope.
Have your siblings or any of your parents ever mentioned you snoring?
No.
Okay, good. Good for you. Now what I'm gonna have you do is you're gonna close one nostril and breathe out. Okay, do the same thing on the other side. Okay, good. So his nostrils are patent. Clearly, we're gonna actually just also have you tilt back your nose, and I'm just gonna once again shine this light in here, and we're just looking for polyps, anything, any deviated septum, which it doesn't look like he has at all. And obviously when we're just looking at the nose, it's perfectly symmetrical, it's straight, and looks exactly how we want it to look. So now we're gonna check out your mouth. So from the outside here, we see everything looks normal. No facial droop. I want you to, and his lips too, we're noting the color of the lips. Dusky or blue lips would indicate he might have some oxygenation problems, which you clearly don't because they're nice and pink. No sores around the mouth, which is perfect. Do you get any cold sores, or have you had any bad chapped lips or breaking
Sometimes.
of the lips? Do you have, whenever you have chapped lips, do you have sores that last a long time?
A little bit.
Okay, and that's pretty normal with diabetes, and we'll talk about wound care more when we're done here. So I want you to stick your tongue out and move it side to side. Okay, great. Now that's cranial nerve 10, so we know that's functioning. Now we're gonna test another cranial nerve here. It's cranial nerve 9, and you're gonna just stick your tongue out and go, ah, and I'm just gonna depress with the tongue. Great. So that little dangly thing in the back of your throat, when you do that, it moves up, and that's called your uvula, and that means that cranial nerve 9 is intact. So once again, yes, sorry, you can put your glasses back on. We're looking at the inside of the mouth. I'm just gonna look inside, look inside your cheeks. His mucous membranes are moist. Stick out your tongue for me, great. There's no sign of yeast infections, which is very common in diabetics. Any sores in his mouth looks good, and everything's pink and exactly how it should be. Have you been able to taste food okay?
Mm-hmm.
Good, okay. His soft and hard palate also look good. The uvula is center and moves. So now we're gonna look at your neck. And once again, I'm actually gonna unbutton this, Ricky, sorry. I just wanna really get a good look at your neck. Once again, everything here is symmetrical. We see his bounding carotid pulses, which we already checked. Now we're gonna test cranial nerve 11. So I'm gonna have you move your head side to side, up and down. And then I want you to shrug your shoulders against my hands. Shrug them as hard as you can. Yep, good job. Okay, so we know that that cranial nerve is also intact. Now we see his trachea's midline. I'm gonna have you just tilt your chin a little so we can really get a good look here. And I'm just gonna lightly feel, we can feel his voice box or larynx. We can feel his thyroid here. This is all normal. And now I'm just gonna kind of start just lightly palpating the neck. And I'm not feeling any lesions or lumps. Does this feel okay when I'm pressing?
Mm-hmm.
Okay, good. Great. Now, I'm also gonna feel, once again, just some areas where you have lymph nodes, and I want you to tell me if there's any tenderness or soreness in these areas.
A little bit.
A little bit, okay. Yeah, you got some sort of infection somewhere. Okay, so now what I'm going to have you do is change into a gown, or actually we might just cover you up a little bit, and we'll do our abdominal assessment, and we'll check your arms and your legs. Okay?
Okay.
Okay, so for our heart sounds, we're gonna start at the sternum. We're gonna go to the second intercostal space on the patient's right side, and that's the aortic valve, followed by the pulmonic valve, Erb's point down here, the tricuspid valve, and then just over to his left is the mitral valve, which is where we find the apical pulse. So we're just gonna do a full listen of his heart sounds, once again, starting at the second intercostal space, aortic, fabulous. Your heart sounds beautiful. And actually, before I listen to your lungs, I'm also just gonna get an anterior posterior view of Ricky here. Sit up straight for me. Now, when we're looking at the anterior posterior, we're making sure that his chest and back are straight. If you see a barrel chest, that might mean that there's some cardiac problems, and we probably already know about those, but front to back, he looks perfect. So now I'm going to listen to your lung sounds, and what I'm just gonna have you do, just take big deep breaths, just like that.
Okay.
You don't have to hyperventilate or breathe really fast, just breathe in a way that's comfortable for you, okay? So I'm gonna start up here. We're gonna start at the apex of the lungs, and we're gonna start up here, go across, and we're gonna go all the way down and kind of following the rib cage. So we'll eventually be going kind of out to the sides here to really listen to these lower lobes, okay?